Welcome to Data You Can Use, Approach for DTM and Partners Cooperation. This is the third of 5 briefings on how to get useful and usable data and analysis from DTM location assessments. It's a briefing for DTM and partners, including clusters, authorities, working groups, sectors, IOM programs, and other organizations. This briefing explains how DTM data fit in partners' decision-making process, the roles of DTM and partners at key points of the needs assessment process, how DTM and partners start identifying information needs and gaps and do not start by drafting questions, and finally the use of a data analysis plan. The approach and tools described here were not developed in isolation. They are based on best practices in the humanitarian sector, and they were developed through consultations with DTM, clusters, AoRs, working groups, and other partners. In addition, the approach and tools are adapted from work done by the group on useful and usable data and analysis, a group under the Grand Bargain work stream on needs assessments. This group is composed by global clusters and area of responsibilities, UN offices and UN agencies, including UNHCR FIX, WFP VAM, OCHA FIS, OCHA NAS, and DTM IOM, donors, including DFID, ECHO, and OFDA, NGOs, including MAP Action, REACH Impact, DRC Danish Refugee Council, Geneva Center for Humanitarian Demining, Terre des Hommes Lausanne, and other organizations like ICRC, and other initiatives including ACAPS, GIPS, and PIM Protection Information Management. This work is the result of years of combined experience and months of targeted effort, and DTM is grateful to all those who contributed. Where does DTM sit in the partners' analysis and decision-making? DTM is one of the tools partners use for their evidence-based decision-making. They use all the data and information at their disposal, including DTM. The added benefit that DTM brings is that partners can participate in the planning phase, can engage with DTM at the planning phase of the exercise, and use DTM to fill their specific information gaps. And this is an example of that. The Child Protection AoR uses needs identification and analysis framework that takes into account the DTM data, highlighted with the red circle and the arrow to the left, together with the number of other data sets from other sources for their analysis, for their interpretation, and for their response. DTM works as many of the other actors and partners through an assessment process that DTM calls the common DTM process. Work done by the working group on useful and usable data under the Grand Bargain identified that most processes that actors in the humanitarian world use are going through the same steps. There might be some differences in the name of the step. Some actors may prefer or not go through one of the steps because, for example, they're not doing primary data collection, but most of the actors, clusters, organizations are using a similar process. This is the process that DTM uses, and it's important that both DTM and partners are aware of this. It's a 10 steps process, from identifying data users and jointly discussing their information needs, to reviewing secondary data together with sectors partners, especially when it deals with sectoral data. The secondary data review really needs to be done by the sectoral experts in the partner. It will identify the appropriate DTM component, one of the 4 components and many subcomponents for that data collection. It will conduct a risk assessment and will develop data collection tools jointly with the partners. It will use the field companion to identify questions that respond to the data, to the information needs that the partner has and has identified previously. It will discuss data analysis and dissemination with the partners and agree on specific data sets sharing modalities and look at how the feedback mechanisms should be set up. After that, there is another step that is really the training of enumerators, to which the partners can contribute sometimes. And then you have data collection, processing, and quality control, sharing of data, analysis and dissemination through the reports and products, and then gathering of feedback and adjustment. The first step is identification of users and their information needs. So it's important to remember that cooperation between DTM and partners only works when it's a shared responsibility. It's not only up to DTM and not only up to the partners to do that. DTM provides data to a large number of partners, to the large humanitarian community, mostly through public dissemination. And it's used by partners that include authorities, disaster management authorities, ministries, intercluster working groups, CCCM cluster, other types of clusters of area of responsibility, sectors, working groups, and individual organizations. But each response will have its specific partners. So DTM should endeavor to engage with partners from the start, as much as partners should do the same. As I said, the cooperation only works when it's a shared responsibility. This is easy to say, but do we really have the time in the field? Often time and human resources for engaging with all the data users, all the partners, are limited. Clusters, IOM programs, and others are numerous, and data are needed as soon as possible. Often DTM colleagues are under a lot of time pressure to deliver. A phased approach is a practical suggestion to manage such competing priorities. The suggested approach starts with coordinating with other data producers. So the DTM would do that through the IM working group or the needs assessment working group, for example, to understand the plans, the assessment plans, and the main information gaps. And then DTM will start by using questions, answers, and analysis that is suggested in the field companion. These were developed together with global DTM support, but also with global clusters, area responsibilities, and other sectoral experts, and therefore will likely provide useful information for partners. Then the DTM will have to prioritize responders to engage with based on most probably the largest impact and the evolving information needs. It is important that DTM plans to reach all relevant partners and is able to communicate this plan to the partners and articulate reasons for this prioritization. In doing so, reaching out to partners will be able to understand the reasons behind certain choices of engagement by DTM team, and will be able to also be more proactive in their engagement if they want to contribute to getting their information needs met through the DTM. The second step of the assessment process is the identification of information gaps. The important thing is to start thinking from the planned use of the data, not from the question. This is a bit of a change of perspective compared to what people usually do. Contributing questions without a clear link to the information gap and the analysis may not provide the most useful information back to partners. It really wastes time and resources. So the encouragement, strong encouragement, is to start from the decisions that partners need to make, identify the information that is missing to make such decisions. Only after that, DTM and partners will cooperate on drafting and validating the right questions and create an analysis plan and a questionnaire. The analysis plan is important because it will enable partners to verify before data collection whether the questions are actually appropriate to filling the information gap. Identifying detailed information needs before developing the questions is essential. The questions can thus be targeted and obtain the right data for the use. The Venn diagram on evidence-based decision-making and response is useful also to identify the roles of partners and staff and skill sets within partners and DTM colleagues in creating evidence-based decision-making and response. It's really important to remember that partners decision makers, for example, sector or cluster coordinators, members, heads of organizations, clearly will have to identify the decisions they have to take and the information they need and they're missing before approaching DTM. Partner subject matter experts, again, they can be the same people in the case of a cluster, or they may not be, but those who have the knowledge of the subject, they will have to identify what information is available and accessible and where the gaps are. They also will identify the essential building blocks of those sectoral information and the most appropriate sources of those information. The partner's cultural and context experts in a cluster or in a sector could be the local NGOs or the local staff, specialists of the context, will help turn abstract information needs into specific local meaning. They're kind of translating the information needs into questions. But those questions are questions that will be correctly understood in that specific context and culture. The role of DTM, as well as the partner's IM expert, if that exists, as in the case of a cluster IMO, at this initial stage will have to be listening and understanding the identified needs, because then it will be up to them to translate them into questionnaires. Step number 3. Is DTM location assessment the appropriate source? The partner will have to go through a decision-making process, a thinking process, before deciding to approach DTM, and understand whether the DTM location assessment is or not the appropriate source for their information gaps, specific information they have identified as needed for their decision making, but not available. Partners will have to evaluate that, and they will consider method of data collection, level of analysis and measurement, feasibility, resources, including time, and access that DTM and alternative approaches have. The DTM location assessment mostly uses interviews with non-sectoral experts, key informants, and observation at community level. The data collection is carried out at regular time intervals, enabling the monitor of changes over time. There are limitations to it, but there are also strong advantages. Partners IM experts will explain the strengths and weaknesses of the possible data collection methods, all of them that are available, and help the partners select the appropriate one for their information need. If this brings the partner to decide that location assessment is not the appropriate source of information for their needs, they can still discuss with DTM alternative tools. As we remember, there are many components and many tools in the DTM approach. And maybe one of them will be appropriate. For example, through surveys, ad hoc surveys or registration. And then they will look at different systems as well, including their own cluster assessments or any other tool that is available and feasible for the context. In a few words, the message is, if partner has a better source, more appropriate for their need, please use it. Otherwise, let DTM know, and they will gladly help. Step number 5 was the identification and development of questions and data analysis plan. A data analysis plan links the use of each information to the analysis to that information, the information need, the question and options for answers that are used to capture that information. A data analysis plan helps DTM and partner reach a shared understanding of what question provides what results and how this will fill information gaps. Questions developed without a data analysis plan will likely be delinked from their analysis and use. And DTM will still collect the data, but it might not support partners' response. An example of the data analysis plan, and there are many, is on the slide, and it's a simple Excel with rows in which at each information need there is one or more questions, and for each question there are options for response, and there is a suggested analysis and visualizations as well as use. What are the roles of DTM and partner staff in developing questions and analysis plan? Well, the approach suggests that DTM and partners IAM experts develop draft questions with the support of subject matter experts of the partner and cultural experts of the partner, for example, cluster coordinator and members. Then DTM and partner IAM experts visualize and describe results using random fake data, just to give an idea of what results they will have at the end of the data collection. All of this happens before data collection. This is the planning phase, and that's the importance of doing this before data is actually collected, because at the planning phase, things can be still changed and adapted so to have better results. Then the decision makers, sectorals, and cultural experts of the partner use the visualization, look at it, look at the description that the IAMs have done, and verify that the drafted questions indeed provides the information they wanted, and link question to expected use. Finally, DTM or the partner IAM experts, if they have it, make necessary changes to the questions, finalize, and share the data plan. The next step is really planning for data sharing. It's again planning for data sharing. It's important to plan thinking about already how to share data. It helps saving time and reduce mistakes. The partners and DTM should agree on modalities, times, and frequencies on data sharing in the planning phase. It's true that DTM shares data through mostly public dissemination, for example, the global DTM website, displacement.iom.int, or country websites, or through mailing lists. It is very important that partners' colleagues know where to find DTM data and when it's updated and when it's uploaded on the internet, how to add their address to the mailing list if that is the tool that the DTM coordinator is using to share data and reports. And it's also very important that partner colleagues inform their replacement of all of this when and if they leave, so that the information is not missed and the replacement will be able to continue the cooperation with DTM and the use of the data. DTM does not share sensitive data publicly. When DTM and partners identify specific data sets as sensitive in the data analysis plan, so in the planning phase, they also agree on data sharing modalities, and they agree and sign on data sharing agreements or MOUs, and that will enable a swift data sharing when the data come in and when the results of DTM are obtained and then processed. In addition to data shared after processing, DTM partners should also agree on the modalities for urgent action data sharing. Those are data that need to be shared immediately as collected with the right partner which will be able to give an immediate response. This, for example, happens in some countries between DTM and child protection colleagues, where certain data sets are considered particularly important and they're immediately shared with the field actor, the child protection actor in the location. This agreement on data sharing for urgent action will ensure that DTM first recognizes the data that the partner needs for immediate action, because that's not necessarily clear to DTM, but it is clear to the partner. And second, know how and with whom to share such data in real time. Step 6 is the cooperation for possible cooperation for enumerators training between DTM and partners. Specific partners can provide specialized training for DTM enumerators, and that will help because it will ensure that definitions are commonly agreed between the people who ask the questions and the people who will then analyze and interpret these questions. And also helps identify appropriate questioning modalities. Examples again with child protection, training by the area of responsibilities in some countries to DTM enumerators, as well as DTM protection colleagues providing training at the DTM enumerators training. The time investment by the partner, which is a time investment, will result in increased reliability, trust and ownership of results by the partner, and therefore better use. Step 9 is the analysis. It is important to clarify what we mean with analysis. Analysis is done at various levels. Those levels should be clear to all actors. Each level relies on the level coming before, the preceding level. It is important that DTM and partners agree in the planning phase on their respective roles at each of the analytical level. As you see from the visual in front of you, which is adapted from ACAPS, on the right you have a red line that becomes dotted where it says DTM analysis, and a blue line coming down and becoming dotted that says partner cluster analysis. It is in fact usual that DTM will come up to a certain level of analysis of their data. For example, will explore the data, describe the data, making charts and maps and tables, and maybe explain some of the trends that they notice, especially when it comes to population movements. But they will not try to give explanations of what data mean within sectoral expertise, because the DTM is not there to do sectoral analysis of the data. That is the role of partners, including clusters and sectors, that will definitely look at the explanation and correlation between data sets and between results, and will collectively do an interpretation, giving meaning to the data and the results. And they might even go into predicting and forecasting what may happen, and should go into prescribing options to change a situation or to improve the situation that will become response planning. So it is important because there is an overlap. The partner might decide to do their own descriptive analysis and only request the data, or they would prefer that DTM does a descriptive analysis of their sector, and DTM may, according to the resources, be able to help the partner in doing that. It is important that this is clarified before in the planning phase, rather than arriving after the data collection and find out that all the data that was collected cannot be really analyzed because neither DTM or the partner has the necessary resources to do that. As said, DTM and partners have some clear roles in the analysis at different levels and some overlapping roles that need to be clarified. DTM usually conducts an exploratory and descriptive analysis of results. The explanatory interpretation and prescriptive analysis, as much as the response planning, are the responsibility of the partner as per their mandate and skill sets. DTM and partners agree from the planning phase on whether DTM will share some type of descriptive analysis, and also can agree on how these results should be analyzed. What type of charts, what type of maps, and what types of tables, what indicators to correlate. This will, of course, depend on the resources the DTM team has and the time, as well as the partner. Targeted presentations of results by DTM have been seen sparking and supporting accurate interpretation by partner subject matter experts, context experts, and decision makers. It is really important, and it's based on experience, that if the resources are available, if the partners and DTM can and agree, DTM colleagues can present the results to the partners, the cluster meeting, the specific meeting, and therefore help the interpretation of the data by providing the context of how the data collection happened and what certain information, what kind of question was behind certain information. Of course, the role of interpretation remains with the partner, but the DTM or IM colleagues can help this happen in an accurate way. The last step is the feedback, providing feedback and adjusting. It's also true that partners and DTM should agree on how they're going to provide feedback modalities, and likely in the planning phase. It is vital to keep DTM results relevant to this feedback from partners. Otherwise, the results will not be relevant over time. And again, as previously mentioned, this is a shared responsibility of DTM and partners. Providing and obtaining and working and adjusting on the basis of the feedback is a shared responsibility. Feedback can be provided in various ways. For example, presenting DTM results to partners and listening to the partners discuss and interpret will contribute to identifying necessary changes in the questionnaires and the approach. Bilateral discussions or small meetings can provide specific inputs and enable more an in-depth understanding of the challenges and even the solutions. Feedback can be provided through email. In fact, contact details for feedback should always be present in reports and presentations, as well as sometimes online surveys, and those can really help to capture feedback on the use of the analytical product and the perception of the analytical product. Feedback is considered then by the DTM team, and adjustments are made as appropriate. DTM may not make all the adjustments suggested by the partners, and that is fine as long as feedback on why those changes were not made or the changes that were made is provided by DTM to the partners, so that the partner understands the reasons behind actions and actions not taken. We have now reached the end of this briefing. The next segment will be illustrating the toolkit, the DTM and Partners toolkit that is available online at the link that is on the slide in front of you. Thank you very much for listening.